Good afternoon, everybody. My name is Manish Tripathi. I have permission to take off my mask, sir, as I speak. My name is Manish Tripathi. I am the Vice Chairperson for Singapore Indian Chamber of Commerce and Industries. I have the privilege of welcoming all the participants for the program for India COVID update and check presentation. A special and a very warm welcome to Honorable Finance and HRD Minister, Dr. Palanivel. Welcome, sir. Thank you for joining us. Request Honorable Minister for Finance and Human Resources, Dr. Thiagarajan, Government of Tamil Nadu, to please address us, say a few words, sir.
Thank you very much for inviting me, and thank you for this chance to express my gratitude. Firstly, to our High Commissioner, Mr. Kumaran, also to my own friend, Dr. Chandru, Mr. Manish Tripathi, who welcomed all of us, Mr. Manish Gupta, who is due to speak, and for everybody who put this event together, first, my thanks and my gratitude. As our High Commissioner mentioned, I have multiple reasons to feel very strongly connected to Singapore. As a young boy, I think the first time I left India back in 1977 was to visit some family friends and attend some religious ceremonies in Malaysia and Singapore. Over the course of a career that spanned consulting and banking and trading, I had many reasons or many occasions to travel to Singapore. I lived there for a while, as the Honorable High Commissioner mentioned. I had many strong friendships. My children have very fond memories. I see Singapore as a model state, one where the application of planning, science, technology, and the perpetual drive to improve. I recall a Standard Chartered event where Honorable Minister, now Senior Minister Tharman Shanmugaratnam was our chief guest at the Standard Chartered event with our CEO. And he made a very telling comment. When asked what drives him to keep going, or what to keep so vested and so focused and so driven, he made the comment to Mr. Sands, our then CEO. He said, well, Peter, like you, there's no natural reason we should exist. We don't take it for granted that this small island in the Indian Ocean has a natural reason to exist. And so we're always trying to see how we be more relevant, we be better state for our citizens and so forth. And that has stayed with me for the years since. Of course, as a Tamil, I have another great reason for affection. In our culture, and if you'll permit me, I'll just lapse for a few minutes into Tamil for my fellow Tamilians. Yadum Ure, Yavarum Kelir, என்ற ஒரு அடிப்படை கலாச்சாரத்தில் தத்துவத்தில் வர்ற நம் இனத்துக்கு வரலாற்றிலேயே ஜாவா, கெடா, சுமாத்ரா அளவில் சோழர் காலத்திலிருந்து இருக்கிற உறவும் அங்க வியட்நாம், லாவோஸ் ஆரம்பிச்சு மலேசியா, இந்தோனேஷியா, சிங்கப்பூருக்கெல்லாம் இருக்கிற பல நூற்றாண்டு உறவின் அடிப்படையிலும் இலங்கை தமிழர்கள் அங்கே நிறைய குடியிருக்கும் ஒரு காரணத்தினாலும் என்றைக்குமே தமிழ்நாட்டுக்கும் சிங்கப்பூர் நாட்டுக்கும் ஒரு இணைப்பும் ஒரு பற்றும் பாசமும் இருக்கும் என்றது இருந்தது, இருக்கும், நீடிக்கும் என்றது யாரும் கேள்விக்குறியாக இருக்க முடியாது யாரிடமும். அந்த அடிப்படையிலும் மற்றற்ற மகிழ்ச்சி அடைகிறேன் இன்றைக்கு இங்கே உங்களுடன் கலந்து உரையாடுவதிலும் நீங்கள் எல்லாம் நாட்டுக்கும் எங்களுக்கும் செய்த உதவிக்கு நன்றி கூறுவதிலும். One of the things that our government did upon taking office less than a month ago was to follow our leaders' instruction that transparency, accountability, and an open engagement with the people was of the utmost importance. As you know, we have no experience as a country, as a state, in fact, as a world, not since the 1918 to 21-22 Spanish flu have we had this kind of a global pandemic. And so we're all, to be honest, a bit struggling in the dark. Of course, the light increases every day, but the complexity of it is something we have never seen before. And our basic philosophy is that an integrated approach with the people, rather than trying to keep data suppressed and so forth, would be a much better likelihood of getting rapid results. And on that perspective, both in terms of the medical data, the actual cases, the testing, the fatalities, the severity, the science behind it, is this a new strain, is it not, what are the implications of that? As also how the government was working to contain it. On all of these things, we took a much more open, transparent, and I dare say, inclusive approach where we brought in so many specialists. For example, in Madurai district, we've been able to bring the peak of the curve down within 2 weeks because we took such a distributed approach. We brought in so many specialists, set up a task force. We extended our infrastructure into the villages to prevent spread into the villages, to prevent the village rural population coming into the city because of improved infrastructure in the city like the government hospital. And I'm very happy to say, for example, we brought the numbers down to 1/3 the peak in less than 12 days. So science works, a rational approach works, keeping the people engaged works, and distributing the decision-making, the infrastructure, the support services, and the testing facilities works. Coming to a specific aspect of this, we wanted to have much greater transparency in how donations were handled, how they were accounted for, the leaving of an audit trail, the building of credibility that increases donors' likelihood and comfort of helping us. And so as somebody who has, through the course of my career, been under constant supervision in the financial services industry of the SEC and FINRA and so forth in the US, of the UK FSA, of the European regulators, of MAS, of HKMA, of Japan FSA. Since I ran global businesses, I was simultaneously under the scrutiny of so many regulators and had so many compliance obligations, and in fact was the one who championed the new MAS exam certification process within Standard Chartered Bank and insisted that starting with me down, the senior most managing director in my division, that everybody who faced a client or who potentially oversaw somebody who faced a client ought to be certified and ought to be registered. So from that perspective, we bring that kind of intensity and track record to our transparency reporting, auditability. And in a time of crisis, if you don't pay attention to these things, without even malintent, things break down. We have many ways that things can break down. So I think we have reached a point where we have high credibility based on our actions. We publish every day the funds received into the Chief Minister's Disaster Relief Fund. We publish every few days what they have been allocated for. Every single bill for purchase of items from that disaster relief fund goes through my department, my desk, and I personally sign those bills. So I can account for every rupee and every dollar that is in that fund. As for the COVID situation today, it's no kind of secret that we have new variant, at least, and potentially more. Of course, the human costs are tragic. We see so many cases of families ripped apart, of orphans left behind after both parents have passed. Every single death is a kind of body blow to us. And those of us in administration take these costs very seriously. We try our best to be logical in allocating very scarce resources, starting with doctors and frontline medical workers and policemen in terms of vaccinations and equipment. Now my Chief Minister has expanded that to journalists and other people who are crucial for the functioning of a democracy. And today, for example, we expanded the priority given to industrial workers who have to congregate to keep our production going and our economy up, to the priests in temples. So I've just come back from the Madurai Meenakshi temple, which is in my constituency, and I'm the MLA for. where we have started a prioritized vaccination drive for temple priests and administration, because once the lockdown ends in a few days, we expect that people will start congregating at temples. So, the situation is a lot better than it used to be. It is still quite dire, and we still need a lot of help. Of course, at a time like this, there's some kind of attempts to create some mischief from a political perspective. Let me assure you that there is no politics involved in any of these activities. It doesn't matter which government is in power. Tamil Nadu has prided itself that for the last 50, 60 years, irrespective of regime change, there has been continuity of policy. Of course, there are some questions about what is the role of the federal or union government compared to what is the role of the state government. These were already in some question before the crisis. And obviously, a crisis like this highlights, where the gaps lie or where the differences in opinion lie. And therefore, there are some discussions about that, but that's healthy in a democracy, and they need resolving at some point. Other than that, I can assure you that there is no kind of politics at all involved in any of this. But since I'm speaking now to Sicci, which is industrialists, entrepreneurs, businessmen, I want to shift the focus a little bit and say, as grateful as we are for your aid and as focused as we are today on getting past this crisis, which, as I say, we see light at the end of the tunnel, at least of the second wave. We are also thinking of the future. And since this is my first chance to address this August group as the Finance Minister of Tamil Nadu, I want to talk about, in addition to the strong ties we have by family, by language, by culture, by history, we also want to have very strong commercial and economic ties with Singapore. By coincidence, my personal friend, Dilan Pillai, has now taken over CEO of Temasek. I noticed gladly, there are many people, my good friend Gautam Banerjee at the Blackstone Asia Pacific chairman. So I recall fondly the many friends from my Singapore days, and I look forward to working closely with them and others, and Bearings and all of the investors to see how we can do mutually kind of beneficial investments, projects, and growth-oriented schemes. And in particular, I was just jotting down a few things where I think there's a natural synergy. Of course, the call centers, but also IT-enabled enhanced call centers and digitalization, starting with our own government processes to overall kind of e-governance to things like that. We have a lot of improvements to make. In terms of investments, the crisis has taught us that we need to get much more self-reliant in medical technology, in pharmaceuticals, in kind of resilience related to oxygen production, things like that. But also, we think that the kind of synergy of a place like Tamil Nadu, which is a large state, population of 80 million people, large land banks, and a place like Singapore that can be a thought leader, innovator, high-tech, scientific partner with a relatively high amounts of capital and a global capacity to attract global capital. Things like educational technology, food technology, improvement of the agricultural chain and the processes, green initiatives, sustainable development. For example, we think the future of electricity generation is much more in microgrids and sustainable kind of green energy grids. And as you know, we are the #1 state in Tamil Nadu for renewable energy already, largely wind and solar. And the Adani Group is a big investor in that in Tamil Nadu. So we think there are so many initiatives on which we can work together. And I hope that, this is just the beginning of that. Of course, we never forget our friends. As the Quran has it, there is hope for he who has lost every other virtue. There is no hope for whom has lost gratitude. So, we will never forget the help of our friends in times of distress. But we have ties that go beyond one crisis, and we hope to further those ties as time goes on. I don't want to take too much more time. I just want to thank everybody involved, particularly Sicci for being kind of the nodal agency of bringing it all together, the Singapore Red Cross for facilitating the transfers and the paperwork and logistics, the many contributors from the private and individuals, and also, if I may say so, the benevolent hand of Senior Minister Tharman, as well as Minister Vivian and people of Tamil and generally Indian both background and disposition. And so I'm grateful to all of you. And on behalf of the people of Tamil Nadu, we appreciate it very much. And we look forward to working closely with you once we are past this crisis, which we hope will be in the not too distant future. Thank you again for inviting me and for the opportunity. Welcome.
Thank you, Honorable Minister. It was such a powerful message. Honorable Minister talked about the COVID mitigation, but sir, you also instilled hope. You talked about the future and the business. So thank you for doing that. There is hope also. So the questions are have been asked online. Okay, I'm going to read the question and then we'll see. So the questions, Honorable Minister, I've read it so it'll be easier. Dear all in the panel, how is the safeguards and control measures implemented, and how salient is the process given the alarming number of deaths per day? Is there a compensatory and concrete compassionate process in place? This is from Dr. Gideon.
Yeah, I should not exceed my brief. So let me talk about what I do know, which is Tamil Nadu. All my comments will be constrained only to Tamil Nadu because I don't know what happens outside Tamil Nadu. I haven't traveled, and reading secondhand news is not the basis for information. So within Tamil Nadu, I would say that even while I was in opposition, I had filed a lawsuit with the High Court that the number of deaths were being not reported properly. Because as a legislator, I was tracking the deaths at the crematoriums, and those numbers were higher than the official statistics. The High Court took up my case, other people, the press and so forth, brought it up. But I would say at the peak of the peak, we were seeing somewhere around 2.5% as the kind of fatality rate. Now, of course, that is a huge number in terms of every loss is a big loss. But relative to global standards and relative to the natural death rate, what they call the total death rate demographically in India, actually we have not had a really kind of unbearable situation. It's tragic. Every death is a loss to somebody, to some family, to some son, daughter, husband, wife, mother, father. But at a macro level, we under normal circumstances, we should see about 500,000 deaths a year in Tamil Nadu. You break that down by month, day, and all that, and we compare and see. And relative to the rest of the world, both the total death rate increase, explicable by COVID cases or not, was not that high. And the percentage of infected cases that resulted in fatalities was not that high. It was not so in the first wave. It was not so in the second wave. And just to put that in context, the second wave was somewhere around 3-4 times the size of the first wave. So once our government came to power, and particularly in Madurai district, which is about 3 million people, which I have been charged with overseeing, we started reporting the total crematorium levels, the processing levels, as a way of second checking ourselves. There's still a gap between what we can count, but the gap has narrowed quite a lot. We got to the point of actually thinking about building additional crematoriums to make sure that people could pass with dignity. But as it turned out, we never did exceed the capacity. We're still going to go ahead and build them anyway. You learn from crises and you develop infrastructure. But we have now reached a point where, just this morning, for example, before I came here, we had a bunch of sponsors come forward, and we have said that anybody who passes from COVID The Corporation of Madurai will pay the processing fees for the crematorium, and we will not charge anybody a rupee, at least to help be more compassionate, under very trying circumstances. So, yeah, I'm not saying that it's great. I'm not saying that it's, not tragic. I'm saying relative to what we feared and relative to what we have seen around the world, by God's grace, we didn't hit that bottom.
Thank you, sir. I think that really clearly answered the question. I will go to another question, sir. This is to you. It says, it's a large, big, it's for Government of India, sir. It says, is GOI pursuing the process of getting the approval of Bharat Biotech vaccine from WHO? So maybe Honorable High Commissioner can take this.
Yeah, I'm not sure I'm qualified to answer that because I don't know what efforts the government of India is taking. So if you don't mind, I'll stick to what I know.
How is the situation in rural India, sir? First, if we answer that, because it says that there is a digital divide between rural India and urban India. So how is the information flow and how the vaccine will be administered in rural India?
Yeah, I think we have a big issue here. So let me, since I have this opportunity, let me try and shed some light in a broader context. The gap between rural and urban India is huge in many places, is less so in some places. It varies a lot state to state, and I'll just give you two examples. I attended some seminars as an opposition legislator in Delhi in the last 5 years, and my colleagues from Uttar Pradesh envisioned that the solution to lack of, let's say, underground drainage or pipe drinking water to a house was urbanization. That was their, personal hope that increasing urbanization would reduce their problems. In Tamil Nadu, I said I'm a MLA from a 100% urban constituency, and I have the reverse problem. We have such density of population and such aggregation happens so quickly that our infrastructure is unable to cope. And I wish that people would kind of be more evenly distributed. And that's because if you take a state like UP, hardly 25% of the population, 20% lives in the cities or in the urban areas and 80% rural. A state like Tamil Nadu is almost 50-50. It's about 48-52, something like that, slightly less urban than rural. So this is a very complex problem. It starts with something as basic as access to infrastructure, access to education, access to medical facilities. In the case of a pandemic, there's kind of a tipping point. Once the infections go to rural areas, you are in much worse trouble than if you contain them to the high density urban areas. Because A, it's a big populous country, so there's really no such thing as sparsely populated even in rural areas. And B, the medical infrastructure, the primary health centers, the availability of doctors, nurses, medicines, injections, all of it is substantially different. So, for example, and I don't want to talk outside Tamil Nadu, it's not my ambit. So I'll just give you in Tamil Nadu. The biggest difference between Coimbatore district and Madurai district is that in Coimbatore district, the spread got outside the cities and was prevalent in the rural areas. Now, Coimbatore is one of the most advanced cities in Tamil Nadu, has some of the best hospitals, best infrastructure at some level, not in other ways. But Coimbatore district has struggled to keep, keep things under control, and only now starting to see the turn after maybe 4 weeks. Madurai, on the other hand, we saw this problem coming. So even though I would say Tamil Nadu is probably the lowest urban-rural divide of any state in India, even so, we know the divide is big enough that it would be a serious problem for us. So we, 3 weeks ago or 2.5 weeks ago, took a decision that we will create 10-bed, 5-bed medical treatment facilities, pre-needing oxygen or ICU in every panchayat, in every union, scale it up to a doctor and nurse, hired a lot of fourth-year medical students and nursing students as temporary staff, distributed from RT-PCR testing, which, as somebody pointed out, not only is Tamil Nadu the highest and only state that did only RT-PCR all crisis, but we do more in a day in RT-PCR than most states do, or all states do, in RT-PCR plus rapid antigen. So, because we had that capacity, we sent the testing down to the villages, we sent the staff down to the villages, we engaged a lot of the women's self-help groups to do door-to-door surveys. What we thought would take us 3 weeks, they did in 3 days. They went and knocked on every door and found everybody who had symptoms, brought them to the local treatment center, and tried to treat it. Our best indication is that there's a new variant. Really, if you treat the early symptoms, the symptoms come early, and if you treat them early within the first 2 weeks with the kind of analgesics and the right drugs and bringing the severity down with proper nutrition and support, then they don't really lapse to the stage of needing oxygen or hospitalization. So we took a strategy that created tens of centers for testing, for vaccination, for beds, for doctors, in the rural areas. And that has been our saving grace, because it reduced both the severity. We got it early, we surveyed, we went proactively, found the people who had symptoms and brought them, isolated them. Not everybody has the luxury of isolating in a poor country where average house size may be 600 square feet or 700 square feet. So we created centers where they could come and be isolated. We always had them, but we had them in the cities for 2,000 beds, 1,000 beds, 800 beds. And that was not helpful. We needed 10 bed, 15 bed in every village. And so I think, the urban-rural divide is a reality. At least in Tamil Nadu, it is not so much an awareness and knowledge reality, partly because of the history of our schemes, partly because of, penetration of television everywhere. And the government once gave away free TVs to everybody. We have the least divide in internet access. We are the highest weighted average internet access state in Tamil Nadu, in India, because we have, like any other state, we have 100% penetration in the cities, but we have 60% plus penetration in the villages, and we are less rural than most other states. So, we have been fortunate, but we still admit that there is a big divide, and we act to mitigate the consequences of that divide as locally and as distributedly as possible. That was a strategy we consciously took, and we've been fortunate that it worked out. I'm not sure. I've already told you, within Tamil Nadu, not everybody took that strategy. I don't know what that means outside Tamil Nadu. I don't want to talk about things I don't know.
Honorable Minister, sir, we have come to the end of the program. High Commissioner, sir, we will just take a photo. And before that, Dr. Chandru, I think the last part is the check presentation. Right? Honorable Minister, sir, we won't be taking any group photo because social distancing and the masks. So thank you very much, sir, on behalf of everybody here. Dr. Chandru, you want to say thank you?
Let me just say, of course, thank you again for everything, for the efforts, for the stories. It was so heartening to hear of the individuals, for the funds, for the equipment, for all of the support. I'd be grateful if I could get copies of the presentations, because I can thank the right people. I apologize. I didn't have the data ahead of time, and maybe I wasn't hearing well enough. So I would like to just recognize everybody who contributed, and thank you again for having me. Thank you for the effort. We appreciate it. We know it's one key moment in a long-term relationship, and we look forward to a strengthened relationship coming out of these great initiatives at a difficult time for us. Thank you.